right, today I have with me two of my guests who is very dear and very close to me, Mazreen and Mikhail. I probably have known Mikhail since he was maybe about 5 years ago, and when Mazreen brought him to see me. And these two people has been such an inspiration to me because I see how they interact with each other, and I see how Mazreen's commitment to Mikhail's growth and commitment to Mikhail's recovery has really provided a lot of support and a lot of strength for Mikhail to be where he is today, a very high functioning individual. So let me talk a little bit first about why we are having this talk. I believe that it is time for us to combat stigma, especially the ones that are towards autism. Now, there are so much stigma around autism, and I really feel that this stigmatization must stop. Stigma affects children with high functioning autism, and we know the results of that, right? Because people who are high functioning, they always feel this stigma around them. The moment someone says that, oh, I'm autistic, people look at them differently. They feel something different about them. And another thing that I would like to highlight is stigma affects parents of children with ASD. And later on, we're going to hear Mazreen tell us a little bit about her experience as a parent of a child with ASD. And stigma is the reason why there are so many adults on the spectrum that struggles to live because they have not been diagnosed. So, a lot of people, they walk around, they struggle, and perhaps, when a psychologist like myself look at them, we immediately could sense or we immediately could see the symptoms of autism. But when you ask them, they will say, oh, no, I've never been diagnosed, but I've always thought that there was something, a little bit special about myself, something a little bit different about myself. And today, stigma is considered one of the major problems for delayed diagnosis. Now, delayed diagnosis is not going to help anybody, right? Because, the longer you delay it, the longer you're going to be able to get help. So therefore, today, our guests, Mazreen Murtaza and her son, Mikhail. Mikhail, this year you're 19, right, Mikhail? Am I right? Or
Yes, this year I am 19.
And I love these two individuals, and I love the work and their courage to come out and talk about it because we really need to stop stigmatizing. So thank you so much. Thank you so much, Mikhail, for being here today. So honored to have you, and I'm really looking forward to this discussion with you.
Thank you, Dr. Sue. Thank you for having us.
No worries.
Yeah. Okay, first, Mikhail is my firstborn. At the age of 4, we were told by the kindergarten teacher that he has certain delays in certain maths area, and also speech. So we took him for speech hearing test. Everything was fine, so nothing was diagnosed. At the age of 7.
That was when he was at the age of 4, right?
Yes, 4. So he grew up normal. Very hyper boy, normal boy, naughty as well, jumping here and there. And then at the age of 7, when we enrolled him to a mainstream school, he was he often himself that he find himself excluded from certain groups.
Oh, okay.
He became, and then he got bullied a few times. So from there, we took him to certain remedial classes.
Okay. And because the teachers asked you to take him to the remedial classes?
No, that was on our end. That was on our end because we felt that he needs to catch up a little bit more on his own.
Okay.
The school was giving also remedial classes. The school is very inclusive, I would say. They do encourage all sorts of abilities in that school. which
Okay.
I'm blessed.
Yeah, that
And
is a really good school
yes,
then. Yeah, because a
yeah,
lot of people don't get to.
correct.
I'll just ask Mikhail for a moment. Mikhail, during that time that your mother spoke about, what was going on in your life actually?
What was going on in the school?
Yeah,
Was
what was going on in the school?
um I I would say like from when I was very young, I would say like uh I would say that I was a bit excluded from the from certain groups. I was excluded by some by some of the kids, and I sometimes wouldn't even know. Even today, to this day, I wouldn't know why. There was even like this one kid who who actually later on became a bit of a friend for me, but at this point, he told all my other friends to like not be friends with me, so he tried to like separate us.
Oh, wow.
So, but like I would say like that's probably like just kids. At least for him, that's just kids being young and immature. Mm. But I
But
I
do
would
you
say
find that when you have this when they do you find that your peers were more immature than you, or how do you feel that?
oh, sorry, could you repeat the question?
Do you find that your peers during that time was more immature compared to yourself, or do you find that they are of the same maturity as
I would I uh I would say I don't want to make anyone sound bad, but I do feel like that at the time we were all just kids, like we were all just pretty immature.
you?
Uh I th- I think for me I was just very quiet. I just kept to myself sometimes,
Okay.
and and yeah.
Did they tell you why they excluded you?
No, 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 not really. But like,
Okay. But then, how did you find out that he was being
Say
or
again.
how did you find out that he was being excluded?
Um, most of the times he would come home and tell us.
Okay.
Sometimes I can actually witness it. And the group of parents and the group of his peers and the parents, we are quite close because some of their kids are actually similar to him,
Okay.
similar of symptoms as in ASD symptoms as well. Some are in denial, some are diagnosed. It's just that I think because of what Mikhail has gone through, he tends to mature faster than the rest of the kids. He would understand why he's like that, or why he react like that, or why she is reacting like this. But then then I realized that okay, he is beginning to either adapt himself or making his environment adapt to him.
Right. That's
Yeah.
interesting. It's very
Yes.
interesting. And do you find that, when, do you talk to your other mothers about, you said that, Mikhail was in a school where there were other children with similar symptoms to himself. And did you talk to the other mothers? And you also mentioned earlier that, some of these mothers were in denial of their kids. And I see this very often in my clinic also, they're like, no, 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 my kid doesn't have any problem. He's just very naughty, or he just doesn't listen to me, or something like that. What kind of reaction do you normally get when you talk to parents, like your
Usually,
peers?
usually they would come up to me and say, "Where do you take Mikhail for therapy? Where do
Oh,
you take him for? Do you take him for rehab?" So I was like, I would share our journey, whether it's from the hospital or from the therapy center or from whatever therapy he has gone through. I will share everything, and slowly they will come up to me again. Can I get this contact to this doctor? Can I get the contact for this program? Then I see, because I can tell their kids is similar. They have that behavioral, they have that no eye to eye. It's the very common, but the parents are just like, probably it's one of the mom, or either the mom or the dad is, not cohesive with everything. So
they're not accepting
yes,
what is happening.
so once slowly over the years, then yes, then I see that the parents will come up, hey, where do you take Mikhail for this? Where do you take Mikhail for that? So usually I would share, oh, we went for hippotherapy or hypnotherapy or swimming class, I would share everything. So then slowly you'll be able to tell that, oh, so then they are slowly accepting it. They will send their kids to,
Right? Yeah. So that's what I love about you, Masrin. That you are so open about it, and in your openness, I know that I personally know that you have helped so many people because to share the experience and to have the courage to come out and talk about autism and to destigmatize this whole concept of autism.
Sure.
I want to talk the next thing about just to give some people who are participating with us some idea about what autism is. Autism or autism spectrum disorder. Now it's still a spectrum disorder because every individual with autism, they have different levels of challenges, and there is a broad range of condition characterized mainly by challenges with social skills, repetitive behavior, speech, and non-verbal communication. So, Masjid, I just wanted to ask you, when Mikhail was young, did he have any social skills problem? I mean, we know he has social skills problem because he was being isolated. What about repetitive behavior?
Repetitive speech, yes. Behavior is not so nothing overwhelming.
Nothing overwhelming.
Yeah, he's pretty much normal. Smiling there. So I always tell him normal is subjective.
Yes.
Who wants to be normal nowadays, right?
Yes, we want to be special.
Yes, everyone wants to be special.
Yes.
So other than that, it's more of talk therapy with him.
Okay.
Yeah.
So there was some sort of like repetitive speech, right?
Speech, yes. More speech.
And the non-verbal communication, did he have a lot of non-verbal communication during that time?
No, Mikhail is very expressive. He doesn't like it. He tells me he loves it. He tells me he's sad. He tells me
it's because you have such a beautiful bond with him. And in our research, without this bond, without this closeness, the children will become more and more introvert. And because of this bond that you have with Mikhail, it makes him even more special because he's one of the few ASD children that actually communicate how and wants to communicate how he feels, right?
Because they say a lot of autism kids does not express, has no expression. Mikhail has a lot of expression on his face. A lot. Sometimes it overwhelms me.
And sometimes they don't want to talk. And Mikhail,
I don't have a time that Mikhail don't want to talk yet.
Okay.
Just give him 5 minutes alone and he'll start talking.
Okay. That's really good. So I'll continue. From a clinical perspective, when it comes to diagnosing autism, there is no blood test, no brain scan, or any other objective test that we can use as clinicians and doctors to diagnose autistic. So what we do to diagnose autistic is that we rely on observations of a person's behavior to diagnose behavior. And of course, we have to take a very, very comprehensive history from the family. And when in Mikhail's case, when he first came to me, the diagnosis was Asperger. And when I looked at the diagnosis, then I said, okay, Asperger on what spectrum? And during that time, I noticed that he had some tics. Remember his tics?
Yes. Due to spiders?
The tics that moves. And do you still have that?
No, I don't have those tics anymore.
So this as some of the special, side symptoms that this test shall recover, and the symptoms will be very interesting and how it's all
Yes.
interrelated, and because it's all interrelated to the system. Right. Let's look at some statistics.
Dr. Sue, you're breaking out again.
Let's look at some statistics.
Okay.
It is estimated that the incidence of autism are 1 in 68 children in the US. So 1 in 68, that's quite a lot. So based on this estimate, that would mean that that approximately 10,000 children in Malaysia are born with autism every year. They are on the spectrum, so they are born with autism. But in terms of how many of these 10,000 children actually get diagnosed before the age of 12, I think very, very few of them. So according to also the US CDC statistics, autism prevalence has risen 30% since 2008. That is really a big jump. A lot of it is because people are more aware of the symptoms of autism as they report it, but a lot of it also, I think, there is this very strange growth or rise in autism. So I think today the fact that the children are willing to talk about it is really important, because I think it's going to help a lot of mothers, help a lot of parents, it's going to help a lot of children. What do you think about these statistics, Mazri?
About the many children out there?
Yeah.
Yes, actually there are. I see a lot. I see many, and parents are just tolerating the behavior. They're just not focusing or trying to tackle the issue. They just think that oh, he's growing up, he's just being a boy, oh, he's just antisocial. I don't know. I feel sad. I feel sad that they're not trying to handle it. At some point, I feel like I'm too possessive of my child, because every single move he make, I feel like, oh, do I need to rectify this? Do I need to do something about this? It's just that I'm very, even with my other kids, I do the same. So when I see other parents with the children that with certain symptoms, they're not, I don't know, I just feel for them. Although yeah.
And if you have a child on the spectrum, you can look at another child and you immediately know that this child is on the spectrum. But then when you talk to the parents, they are like, no, my child is not on the spectrum. And you're like,
yeah.
And why do you think these people don't want to are in such denial?
Maybe it's like you said, is the stigma, is what other people would say. They're worried if they have to be enrolled under OKU, they will be enrolled under carrying the card. Even some parents just don't want the OKU card. I told Mikhail, it's okay having the OKU card. We got a lot of discounts, which is fun, So there's no problem with to me acknowledging, it's okay, it's acceptance, it's embracing.
Yeah, because if you don't acknowledge, your child is not going to get help.
Yes.
And having that OKU card has got privileges.
Of course, it comes with it. So to me, it's like when you embrace it, you know what to do with it, and you are stronger at dealing with it. Whatever people say, oh, your child has autism. Yes, he does. And we are very proud of, I am very proud of having an Asperger's son, So it's like, I don't know why people are just, I don't want, no, my son's not autistic. No. So I'm very proud. I'm blessed. I know I'm blessed. Even if I'm diagnosed with one more, with another autistic girl, I'm still fine with it. Sometimes I told her, you know what, Kakak, I think you're autistic too. I'm autistic in a way as well.
I think, there is a genetic component to autism, but there's also, the environmental factor, right? And I feel that a lot of high functioning autistic people, they are just very, very special. They're just very, very special. And I love the way that they look at the world. They look at the world in a very different way, right? So they can help us
Yes.
to create and get out of our, our circular thinking kind of patterns that sometimes is not really that good.
Yes.
Okay, moving forward, you see this picture. I took it from your Facebook. I took it from your Facebook. All right. Mikhail, these are the signs of autism in young children. Not responding to their name, avoiding eye contact. I know that you struggle sometimes to maintain eye contact, not smiling when you smile at them, getting very upset if they do not like a certain taste, smell, or sound, repetitive movements such as flapping their hands, flipping their fingers, or rocking their body, not talking as much as other children, repeating the same phrases. I know that you don't, many of these do not apply to you, but which do you think applied to you when you were much younger?
When I was much younger, I think the not responding to my name and the not responding to my name is something that doesn't really apply to me. But I think most of these also I think most of these would apply to me because like yes I do I at least like when I like even when I do try to force myself to have eye contact, I like feel very awkward. Like I feel like I have to do like I feel like I have to give them team like monster stare. Like I feel like okay, should I turn around? Should I turn away? Or else I feel like I will be making the situation between me and that person awkward.
Okay.
Um, I I do have even now I do have repetitive movements. I do this thing where I listen to music and I walk back. I walk up and down in my room. I pace back and forth in my room.
Does it
I
make you
tell
feel better doing
huh
that?
uh
How does it make you feel like doing repetitive movements?
it's more or less it's just something that uh like when you're listening to music you like have that feeling. You have like
Mm.
a bit of energy. So like when I listen to music like and I do my pacing, it gives me that chance to like release that energy.
Wow, how interesting. Okay. And I
As
remember when I first saw you in like those things people that much don't seem to want to talk to, like when they have other kids in the clinic, they don't seem to want to interact with them.
I'm sorry, Dr. Su, your mic is breaking up. Sorry.
I noticed when you were in my clinic when you were much younger, you don't interact with other children very much. Not, I mean, with your own siblings and your own family members, you interact very well. But with new people, I find that you don't interact with them very much. I know now that it's all in the past, but I mean, during that time, how does it feel when you want to interact with people? Could you tell us a little bit about that?
How it feels to like interact with other people, right? Uh, for me at the time, I think I was like felt like I was like very socially awkward, very socially awkward. I wouldn't even know how to even start small talking, and even now I'm not that good at talking to new people. I would say I'm definitely better at it than I was when I was younger, but the yeah, oh yeah, when I was much younger, I would have like a lot of trouble just even trying to talk to someone or
Okay.
like someone new.
Mm. You mentioned earlier that when you want to make eye contact with someone, you actually feel very awkward about it, right?
Yeah.
Mm. And you feel it in your body.
Yeah. Yeah. Actually, I do feel like feel it in my body like what I'm thinking is that like okay I'm having eye contact with this person. If should I look away now? Like is there a, like I'm thinking should I look away now because I feel like if I look away too fast then it means I'm not engaged with the person, I'm not interested in the person, and I'm afraid that I might hurt the person's feelings. Or if I feel like I don't look away fast enough, or if I keep maintaining eye contact too long, then it's gonna freak the person out. So like for me at least, there's like all these factors that I'm thinking about, and like I feel like I feel like I'm a technician thinking like, okay, should I look away now, or should I keep staring?
It sounds very mechanical and very
Yes,
technical, right?
yes.
You know that.
Mm.
Nazreen, do you have any opinion?
That is about in regards to eye contact. It goes the same to every single movement, every single daily activity. His mind will be thinking, if I do this, what happens if I do that? So it ends up non-cohesive. He'll go like, oh, I do this, and then instead he does this, so everything goes wrong. So if I am not calm or I'm not on that Zen mode, everything breaks loose. But I think by now he's more he adjusts. He has adjusted to everything.
Yeah,
Yeah.
he
After a
has.
while, yeah. It takes time for him. It takes a while, compared to other kids maybe, but he does it very well. Eye contact, even he wants to do specific thing, he is very detailed.
Yeah,
It's
I
as
am.
detailed as how his mind works. Yeah.
That is really detailed, like when do
Yes.
I want to turn away and
Yes.
when do I want to, am I
Until
making
now.
too long an eye contact?
Yes.
That is very, very detailed and it's so amazing. I'm so proud of you, Mikhail. I'm so proud of, all the progress that you have made and how much you have improved. I'm so, so happy about that. When Mikhail first knew me, I think, Mazreen, maybe you can tell them why you brought Mikhail to see me.
Mikhail developed the tics at that age, where every single movement the tics was getting abrupt, what do you call that? It's very, very often and very frequent. So I
He
would
was having it in his eyes, he was having facial tics, he was having
facial
body
tics,
movement.
body tics, yes. Yeah. So we tried to ask him. He said it was since he saw that spider behind him. So we immediately assume it's a spider that has triggered the tics. But it went on for a while. That's why I needed something to actually help him calm down and not think about it and not focus about it. But after a while, it went off. And now the siblings are always joking about the spider and he doesn't have it anymore.
Do you remember what you did to get rid of that spider?
You did some hypnotherapy, right?
Yeah.
Yes.
Do you remember that? Do you remember that experience?
Yes, I do remember. Yeah.
It was very interesting, isn't it?
Yeah.
Yeah, a lot of people say that you shouldn't hypnotize children that are on the spectrum, but I'm totally against that because I find that it actually accelerates the healing for the child simply because um, those on the spectrum, they are so special and they have got such rich imagination. Their imagination is so amazingly creative and rich. If you don't tap on that, you're wasting such great resources, and you just can't use the same method of treating like tics with someone who is normal as with someone who is autistic, because some young children who is normal, they might not have that kind of vivid imagination that like someone like Mikhail has, right? Mikhail, the spider just went away, right?
Yeah. After like a
And then
few sessions, yeah.
yeah, and then the thing just went away with that. Yeah.
Yeah.
So yeah, so these are some of the things. And what other experience during that time? Because during that time also, I remember that you were going through one of those emotional up and down phase that I think most people will go through because how do you process the emotions now as compared to when you first came and see me? Mazrin, you remember when he first came to see me, he had a lot of mood swings, and there was a lot of tantrums at that time. You were very young, Mikhail, so you're not like that now, but you were. So Mazrin, maybe you can give us some of that experience.
Yeah, point, because due to the spider, to the tics, the body tics and the social environment, the anxiety grew. He began to, certain things that he's very anxious about. Uh, Even those who doesn't smile at him, he became anxious. Does not that boy not like me? Does that boy, this teacher not like me? It's every single thing. Yeah. So when we started to see the development after the few sessions with you, he began to calm down. He began to understand why this and why that. So then it's easier for him to accept. Oh, okay, he doesn't want to smile at me. It's okay. He doesn't want to talk to me. It's okay. You know.
You improved a lot during that time after 2 sessions. I remember the second session, even before we went into the third session, you were already, way, moving towards improving, and you were much more confident. What was the main thing that pushed you towards that direction, Mikhail? Do you remember?
I don't think I can say that I do remember, because like it was like pretty long ago.
Yeah. You know what I think? I think when the tick started to reduce, your confidence just grew.
Yep.
I rasa macam tu, I feel that was the reason.
Yes.
Okay, so now let's talk about you being a little bit older. So this is your picture again. Remember, this is the Jakarta picture. I love this picture of you. You're like so chill. All right. So with the sunglasses, you're lying down like
It's the sister sunglasses.
it's so chill. So now you're older, and older children, these are some of the times not seeming to understand what others are thinking or feeling, finding it hard to say how you feel, liking to strict daily routine and getting very upset if it changes, having a very keen interest in certain subjects, getting very upset if someone were to ask you to do something, finding it hard to make friends or preferring to be on your own. And of course, lastly, taking things very literally. For example, if someone says break a leg, you'd be standing there and you'd be thinking, do I break my leg? How do I break my leg? Do you have that kind of, can you tell us whether you have experienced any of these on the list, Mikhail?
Okay, so uh for the first one, not seeming to understand what others are thinking, uh I think that one I do sometimes have it, uh and in fact I do sometimes like assume the worst. I do kind of like assume the worst. It's like for me at least, when my when I see my mom, I ask her, is she okay? Because sometimes I feel like, oh, she's mad. but
But then that's just
but
my face, right?
yes, yes. but like it's not really that she's mad. It's just that it's really nothing. It's just her resting face, or she's just tired. Yeah, so it's not really that because she's mad.
Okay.
But
So
as
how
for
do you deal with that, Mazrin, when the wrong keys and you keep reading your body language in the wrong way? How do you deal with that as a mother?
Sometimes it's overwhelming because Mikhail is very caring. He's passionate. He loves he's a loving person. So when he feels that I'm upset, he wants to try to make sure that I don't get upset or reduce my anger. He wants to try and do it on the spot. So that would actually, trigger my anger, right? So usually I would say, Abang, it's okay, I'm okay. Don't ask me more than twice, and then I know he'll go away. But then when I'll give him 5 minutes, I'll go back, Abang, I'm really okay. Then okay, then it's okay for him. Unless I crack a joke, then he knows it. Okay, it's really fine.
But
Yeah.
it must be heartbreaking sometimes. Do you feel guilty? Do you feel bad? For sometimes getting angry with him for being
Yes, of course. Sometimes, most of the time, if I get angry at him, of course I feel guilty. That's why usually I'll take I just say, don't ask me more than twice, or else I really get angry. So in 5 minutes, I really have to go and check on him and say, Abang, I'm okay, yeah.
Okay, that's good.
Yeah.
Actually, that method is very good. Like when they ask, because you reassure, they are trying to reassure you, and
Yes.
then when you're okay, you go and reassure them back. I think that method is
Yeah.
really good. I think we can find that very good, right? When your mom comes and reassure you.
Yes.
Sometimes he doesn't believe me. He ask me again, are you sure you're okay?
Okay, I don't know how to help that one.
But we work things out. Yeah.
What about the rest? Michelle?
As for the rest, I think for taking things literally, I think that's on a case by case basis. Like sometimes I don't really take a lot of things literally, but like other times I do feel like I do, like when I'm a bit very like stress. And when I say stress, I don't mean like super stress, but like the stress that like gets you focused. So like I'm so
Right.
focused, all I hear is okay, break a leg. I like hear just break a leg, and I don't hear the meaning of break a leg.
I see. Because you're focused on something, right?
Yeah.
Because you're focused, yeah. So that is really, a lot of times, that is quite common, because your mind, your that very special mind, allow you to focus so deeply on something that, when you hear something, it's just very literal.
Yeah.
That's interesting. Yeah. What about what about getting very upset if people ask you to do something that you don't want to do?
I do. I mean, I think like as an adult, like now that I'm actually in training as a video editing apprentice, and at this place they essentially taught us like these three key things in order to make it into the working environment. And that is our reliability, uh leaving your emotions at the door, also consistency, and also sorry, knowing how to do your work. And so, like, for me, I do have to like practice the leaving your emotions at the door. So like sometimes there will be days that I just don't want to go to work, like either because I am very tired, or because I feel like today I'm going to have a bad day. So what I, so but then I have to like leave the emotion at the door. And when I mean at the door, I mean like I have to put it to a side. I cannot think about it and have to like actually go to work.
Yeah,
I actually
because
have to go
you're
to
an
work.
adult now, right?
Yeah.
You need to have the responsibility.
Yeah.
And I
And
love the way that you take on this. I know you keep on challenging, just
yeah.
grab it and you just embrace it, and sometimes I know you use willpower to push yourself, but you did it. What do you think?
Hmm.
Yes, Mikhail just need a little bit push, and he's out there. I
Does
think
he,
that's what I just did. I just a little nudge, and he's out there.
does he wake up on his own?
Yes, yes, he
Fantastic.
does. He makes his own food. He's very independent now. It's just certain things that I have to remind Abang mandi. That's all. Then everything else goes smooth.
Okay.
Yeah.
Wow, so he's getting more and more independent.
Yes. Only recently I have learned to let go for him to take the grab, because I always worry about him going out into the world to take LRT especially, or MRT. So we recently started letting him take the grab. And then he recently learned how to use the grab food, which
Oh
is,
wow.
oh my God,
How do you grab food?
hari-hari grab food. But using grab, I can see where he goes. So that gives me some kind of relief,
Yes.
which is good. Now he can grab. So I'm relieved that at least he knows to get from point A to point B without me on
Yeah,
his
I,
own.
I, I think,
Yeah.
Mikhail, a lot of people think that autistic people, they don't know how to do anything. They cannot be independent. I think you have proven them wrong. You have proven that, hey, I can be independent. I can go out and work. I can earn money. I can do a lot of things, right, Mikhail?
Yeah, absolutely, yes.
Hmm. And what is in terms of independence, how does it feel, you know, to go out there and to like take a grab on your own? How does it feel to do all these things on your own?
Uh, okay. So
You still
as
have that robot thinking, like the technical thinking?
oh, absolutely yes, absolutely yes. Actually, no, it's more so because with Grab, I'm thinking, okay, like where because like in certain malls, like they have certain pickup points, and
Mhm.
I'm not too sure like okay, so like on the Grab it would say, okay, you have to go to Tower A or Section A, but when I get there, nowhere in the building it says Section A, so like it's not clearly telegraphed for me whether
Mm.
this is Section A or not. So I don't know whether this is Section A or not. But like I for me at least I I'm able to like overcome that like this just by asking people, by just tapping into my kindergarten brain and asking them in Bahasa, is ini Section A, because I'm not that good in Bahasa. My Bahasa is kindergarten level at least.
But you were able to reach out to people, right? You were able to reach out to people because you are lost, and you're able to reach out to them and ask them, okay, ini section A dekat mana, and all that kind of things, right?
Yes, yes.
Fantastic. Yeah. You should be proud of yourself to be able to do that. And how is your work? Can you tell us a little bit about your work? I know you're doing video editing.
Yes.
How do you find your work, and how do you find the routine of work?
Uh,
Because with video editing, there's no
oh, sorry, I think you broke up. I think you're breaking up.
with video editing, there is so how do you cope with those changes?
Oh, sorry, Dr. Su, you're breaking up again.
Okay. Um, okay. How do you cope with the changes? Because when you're working, there is no fixed routine. So how do you cope with the constant changes? Um, when there is during work.
Okay, so I have to be very careful with what I say because one, my boss could see this, and or I could accidentally say something that I'm not supposed to. Okay, but
Okay, we won't go to anything that you are not comfortable saying.
it's okay. I'm just joking. But as for like the routine, like for at least for my workplace, there is like a schedule. There's like a schedule. Is it like a schedule? Now, just keep in mind we everyone there is treated like adults. Most of the people that I work with are interns. We are treated like adults. So like the schedule is only to like tell us, okay, we're gonna meet with our boss at 12. Gonna meet with our boss at 12. We're gonna have to finish this project at 11, and then we're gonna have like break at lunch. At break at We're gonna have break at 1. So
Okay.
there is a schedule, but it but like yeah, is just to like tell us what meetings we're supposed to be in. But as for like personal work, what we're supposed to do by ourselves, I do try to keep myself to schedule. And like nowadays I am writing my own work schedule to my supervisor. And and actually sometimes yeah, I'm trying to send I'm trying to keep to my own schedule of what I have to do in the day.
So your boss or your supervisor have enough trust in you to allow you to write your own schedule and then keep to your own schedule that you have written, right?
Yes, yes, for most part, yes. And
In your work,
oh, sorry, you're breaking up again. Sorry.
do you work in a team or do you work as an individual at work?
Okay, very funny story. Okay, so like I did work in a team. I did, but what I mean is that the interns that work with me, they have now graduated from the program as interns, and now like in my group, I'm the only one who's doing video editing work. So
Oh,
yes, so essentially uh, but my supervisor, she does help me she does help me um when it comes to like trying to validate certain thing, certain edits that I do. Yeah. And
Okay, so you were in the team, and now you're back to individual video
yeah,
editing.
yeah, I'm the whole team.
Wow.
Every time we do like a roll call or a roll call of like the team, like, okay, is this team here? I would just say, oh, I am the team. I am here.
Okay, it sounds like you're really enjoying your job, though.
Is definitely like a tough is a tough job for me at least, because one, I am not I may be doing video editing, but I have not been to film school, so I don't know any of the techniques or any of these theories that you learn in film school. Currently, what I'm doing right now, I am learning the theories from a video editing professional that Ketron has, but for most part, I am doing mainly practical.
Wow. Okay, fantastic. And it sounds like you're coping with.
Oh, sorry, your mic
It
broke
sounds
off.
like you're coping very well with the workload and it doesn't even stress you out,
Yeah.
right?
Yes, yes.
Fantastic. So how does it feel to receive your first paycheck
Oh, okay. Wait for my
after dinner, or did you give them a treat, or what?
Okay. For my first paycheck from Ketron actually. Okay, so the story was like my workplace actually wanted to have like an outing with all the workers at the time. So I suggested we go to the KL Park, which I helped organize with another intern. And so by the end of the trip to the KL Park, uh, um, the man who runs the whole organization, Care to Run,
Okay,
uh, he he started to give out all these like these small money packets, the one that you get do it Raya or Chinese New Year, and
okay.
like the one that he gave to me was like my paycheck. Yeah. So and he said like you earned this, so good job. Yeah.
Wow. Wow. That's it must feel so good, to
Yeah. Yeah.
but then you must be so proud of your first paycheck.
Yep. I'm very proud.
That's amazing. I really like how you go into this job with such enthusiasm and confidence. I really like that. Okay, I want to talk a little bit about autism in girls and boys. Autism can sometimes be different in girls and boys. And for example, autistic girls may be quieter, may hide their feelings, and may appear
Yep.
to cope better with social situations, but actually not. And that means that it's really much harder to spot, autism in girls. Mikhail, do you have any friends that when you having this special powers, when you with friends, can you spot other people that have like similar symptoms to you?
Uh,
Like, would you
uh,
know that someone else also may be experiencing the same kind of problems that you have challenges?
I would say that I would have like a feeling. Like if I see them, I would say that, oh, okay, I think like there is something I'm feeling about this person. Maybe he or she might be on the spectrum, maybe.
Okay,
Uh,
right. Nice.
but like for me at least, me personally, I'm technically of the belief that like even if like if someone like shows like one symptom of like autism, like just one, that doesn't necessarily, to me at least, means they're autistic. Like if someone doesn't like to have eye contact, that doesn't necessarily mean that they're on the spectrum. It could just mean that they just don't like eye contact.
True, I absolutely agree. Some children are just shy, they just don't want to be like. And that's why it's important, that we actually get this properly diagnosed and not through Google diagnosis. A lot of people do Google diagnosis. That might not be the best way. Do you have any input for us on this one, Masri?
Say again?
Any feedback, or do you want to say anything about these differences in gender in autism?
I would agree that it's harder to spot on girls. Like what we all agree that girls could be shyer, girls might not want to make eye contact because they're girls. And for instance, I see in my daughter, it's just recently that she has this tendency of being so overwhelmed with noise. She just can't take loud noise, and she has that cringe, and she has that anxious feeling. So that's when I realized that she has this autism trait. Yeah, but I'm still reading. I'm still trying to spot whether she is.
I think
Yeah.
with Michaela, I think you just have to let her wear some earplugs, or you let her wear some headphones.
Yeah, that's why she has this huge headphones like the brother. So when we all go out, them two will have headphones on.
It helps, isn't it, without the headphones?
Yeah.
Does it help you without the headphones? How does the headphones help you, Mikhail? Maybe you can explain to us.
Uh, at least for me, the headphones like they help not only with like blocking out noise, but also like at least gives me control of what noise I can hear. Like if I don't want to hear like all this train sounds and all this loud car engines and other people talking, I can just use my headphones and like listen to like my favorite music, listen to my favorite YouTuber or or anything like that. That gives me control of what I let into my ear.
So it's more about being able to control your environment, isn't it? Being
Yeah,
given the opportunity to be able to control your environment, to decide what what are the sounds that you let in and what are the sounds that you let out, right?
yeah, yeah,
Sounds is sounds you think can trigger.
yeah.
What kind of sounds
Uh,
that you
I
don't
see. Oh, sorry, I think you're breaking up. Can you repeat that?
do you not like to
I think I can only speak in my experience, but I honestly don't like um I don't know if there's like an actual word for this, but I would classify them as like chaotic sounds, like sounds of a like all of a sudden a jet engine uh coming past. Like if it's like all of it, like if it's sudden, then like that kind of would like trigger me a bit. Like like the static of a TV, like the sudden motorcycle engine that rushes past you. The sound that doesn't really bother me when it's very loud is just like my music, the music that I put on, and I think my mom can attest to this because sometimes I will have my music very loud to a point where she will have to call me 3 times, or like when I'm in the back of the car, she will have to raise her hand so that I can see it, and so that okay, she's calling me, I should take out my headset and listen.
okay? Wow. Okay. So I think you hit the nail on the head. A lot of people who are on the spectrum, they just don't like sudden noises. Sudden noises like a backfire of an engine, or a sudden, airplane sound, or certain sounds that are not, in sync with the rest of the other sounds that are in their environment. That tend to, trigger them. But Mikhail, you putting on the music so loud might not be good for your eardrums.
Yeah, yeah, my mom. Yeah,
Maybe you can combine it with some ear muff. You buy the ear muff, and by the way, if you use ear muff at night, you can actually sleep better. Have you tried that before?
oh sorry, you broke up again. Can you repeat
If
that?
you use those earplugs at night to sleep, you can actually sleep well.
If I use the earplug,
Yes, if you use the earplug. So by giving them those earplugs to put off and then let them sleep because they can actually sleep better because then there's no sudden noises that that can cause them to wake
uh,
up.
but
Like,
yeah, but like it wouldn't be as fun as listening to music though.
yes, yeah, of course it
I
will
don't
be.
think earplugs works for him. He doesn't want to sleep. He doesn't want to sleep.
So sleeping is a choice. So if you don't want to sleep, then
Yes.
what time you normally go to sleep?
Say again?
Mikhail normally goes to sleep.
Hmm.
Yeah. What time do you go to sleep?
Okay, okay. uh, okay. So like we're talking on weekdays. We're talking on weekdays
Uh-huh.
when I'm working. Okay, when I'm working, I usually try to go to sleep as like for most part as soon as possible. Like around 10, like maybe around 10,
Okay.
around 10 or 11.
Okay.
But though no mom, I do go to sleep at around 10 or 11. But like the worst case scenario in like the weekdays is that I will go to sleep at around 4, and I will have to get up at 7. I would sleep at 4 or 3 4 or 3 and wake up at 7.
4 o'clock, Mikhail. Hello.
The other day.
I kind of like the 10 to 11 better. 4 o'clock in the morning. Playing games.
No, there's only the worst case scenario. Worst case
Okay.
scenario, I sleep at 4 or 3.
Okay. Okay. I hope that's not often.
We'll see this week.
Okay. Like I don't mind once a month, but not once a week, right?
It's worse on the weekends.
Now, a lot of I want to reach out to a lot of parents out there with autistic children because autism does affect parenting style and it does affect the way that we parent and bring. And also there's a lot of difficulties with caregiving. It decreases parenting efficiency, it increases parenting stress, and of course increase mental and physical health problems. Um, for you, Mazrin, what is your biggest challenge in taking care of Mikhail and maybe Michaela?
Biggest challenge, I would say that first, what I needed to do was reduce my expectation. My expectation has been not reduced in a bad way. I just reduce. I want to follow their pace and their ability. If I have that certain mainstream expectation, then of course it's chaos. So my parenting would be according to my children's pace, according to their ability. I began to fade out whatever the normal stigma is. Oh, your kid should be here, should be doing this, should be doing that. I said, no, it's okay. Like even my youngest, he should be in year 3, or no, it's okay, he's in year 1. I've learned to do that to myself. Because or else I'll go crazy.
Yeah, so you follow their
pace.
path rather than trying to push and push and push
Correct. Yes.
society's expectations on them, right?
Yes.
That's wonderful parenting. Yay! Mikhail, your mom did really well, didn't she?
Thank you. Yes. Thank you.
She's just a really good mommy. Yeah.
Thank you.
And I think that really helped Mikhail to become a more confident person as well, right? Because I see in my clinic, when parents start to push their autistic children and expect them to, join the mainstream, it really puts a lot of pressure on themselves.
Yes.
And on
a
the
lot of parents want their kids to be normal. I don't understand. Why do you want them to be normal?
When you can
Yes.
yeah.
Yeah.
I look at Mikhail, Because have you found something that you're really, really, really passionate about and something that you really like? Like, I just want to show you a picture that you drew. This picture was from, what?
I'm sorry, Dr. Su, but I can't hear you properly.
This was something that
Oh,
I created a long time ago. Yeah, and I love the colors in it. And, so do you have something that you are passionate about now? Something
Uh,
that,
uh, I would say actually I've been seeing this a lot in myself, but even when I look back on it, I feel like I'm more drawn towards creative options like storytelling. Like nowadays, I'm interested in storytelling, 3D animation, and and all of that. And all that like in terms of storytelling, I'm interested in world building, character arcs. I love watching these YouTube videos that are about dissecting certain characters, dissecting certain story arcs in TVs and movies.
do you still like the chaotic Peterson? Those weird.
What? Oh yeah. Oh yeah. I have honestly stopped. I did stop watching him, but that's not because I don't like him anymore. It's just that it's that thing that where you just kind of automatically stop watching a YouTuber for
Yes,
some reason.
yes,
But
yes.
I definitely do like content like that where you just learn about certain animals and learn about certain creatures. In fact, the other day, me and me, me, my mom, my sister, and my grandmother and baby brother went to a shopping mall, and there was a petting zoo, and they allow
Oh,
us to hold like these lizards,
oh
like these
wow.
lizards. Yeah. One of them put the lizards on my shoulder. My mom also took a video of me putting one of the lizards down.
Oh, I need to see that video.
I'll send it to you.
Okay, okay. And then what happened? Did you enjoy it?
Yes, absolutely. I definitely enjoy the animals.
Mikhail has become an animal lover.
Oh, I
I
love
would
it.
think that
Because you remember all the animals that I showed you, all my pets, my snake and
yes,
everything. Yeah,
Yeah.
so I'm so glad. I'm so glad that you like animals. Maybe one day I'll bring all the pets over and show you again.
uh,
Because, back in 2019, you said you wanted to direct a movie based on Transformers. During that time, in 2019, you were very, very much into Transformers. You remember that?
Yeah. Yes.
he's
You
still
remember
into
how you
Transformers.
you were like, oh, Transformer, everything about the Transformer, you knew everything about Transformers. That was so amazing. Do you still want to make a movie now about Transformers?
Say again. Sorry.
Do you still want to make a movie about Transformers?
I th- I think like for me at least uh for m- for me I have this habit of like I am like when I in my free time I tend to like daydream of like creating stories and creating like these fun worlds that like if I had like the tools if I had like the tools to like create these worlds like if I was able to animate something, I'll definitely like make these worlds come alive. In fact, like there's this one guy who there's one guy. His name is his name is I think Christian Peterson.
Okay.
Um, he's he said I think he also quoted this. He said that a lot of people have like these awesome ideas. They have these A class ideas, these A class stories, these amazing stories, but they are hindered by the fact that they themselves are thinking, oh, I cannot tell this story because I cannot do this. I cannot tell this story because I cannot animate. I cannot tell this story because I cannot direct. But like from what I've heard, from what he has told me, and from what I've seen, is that you don't necessarily need to have these tools. You don't always need to have these tools. It's good, but you don't need them. You can just go ahead and tell your story.
Totally. I totally agree with that. Yeah. Amazing. I love the way that you said it. I love the way that you're looking at things from the perspective of narration, of the storytelling part. That's really interesting. Yeah. Mazri, coming back to you, do you have any advice for women out there, or mothers out there, or fathers out there with autistic children?
Well, I think they should just listen to the child, follow their path, try to see if you feel that that's the niche, go for it, and expose them to as many adventures as possible, as many experience as possible, and see which he sticks to. He might not like it, whatever you have exposed, but at least you've tried. I've tried coding with him. I've tried horseback riding with him, just to see which actually clicks with him. So I'm
Scuba
still trying.
diving, and scuba diving, right? Because I gave you a
Diving?
letter that says you can
Not
do
yet,
scuba.
not yet.
Oh, you
Because of the
haven't?
pandemic, we stopped.
Oh, okay,
We
okay.
didn't get
Okay.
to.
All right, next
Yes.
one.
Yeah, next one.
So you want to expose them to all kinds of
Yes.
activities. Yeah.
Correct, yeah. Because I want to see if he is into certain activities, that's where I will try to polish. If he likes editing right now, animation, we'll go for that. Maybe that's what he can, do something with how to sustain his lifestyle, his
Yeah,
life.
because it's his
Yes,
gift,
I need to
right?
find
And we
something.
must
Yes.
try to look for all the gold nuggets.
Correct.
Like, that's very, very good advice. So just to summarize, the advice is to let the child lead you, and whatever the child has a passion in, let the child do more of it.
Yes.
I think that pretty much says it, isn't it?
Right.
Okay. So in 360 Wellness Hub, we have a cutting-edge autism enrichment program. And besides psychoeducational advice on diet, lifestyle, and environment for parents and children, it also includes a lot of things that I've done with Mikhail: sensory activities, neurostimulation, hypnotherapy, and of course counseling and support for parents and child. So when it comes to autism treatment, it needs that additional thing. It needs that sensory engagement. The child needs to, like, have all their senses activated. And I think that that can really help them to balance, to secure, and be more confident in their motor skill and memory, and everything is really very hyper. But if we can help them to just mitigate them and manage it with balance, that would be really, really good for their recovery. I think because you're quite good, you're quite hyper in terms of your sounds, and in terms of the smell. And what about taste? In terms of your taste as well, according to the pulse that I have given. Visual, I know you're very good, so you're very hyper in all this. And we use neurostimulation, that machine that we put on you last time, to just improve your neuroplasticity, and then hypnotherapy to assist to target the area of the brain, and of course the counseling and support. So when you think about treatment for your child who may be autistic, you need to think about a whole. You cannot just do one thing. You just have to look at it from a very holistic perspective.
True.
There are no cut and
There's no shortcut.
shortcuts. You
No.
seriously no shortcuts.
No shortcut. Yeah. But so I can hear you.
Many family members have succeeded with these 11 tips. Mikhail, as we go through this, I want you to tell us whether you think this is going to be useful or not useful. Okay, we are going to be the judge of it. You have to be patient with kids. What do you think, Mazri?
Yes. Lots of them. Tons of them.
You have to teach the kids how to express anger without being too aggressive.
Yes.
How do you do that? Let's say, Mikhail, when you're angry, how do you want people to approach you?
How I want a person to approach me?
Yes, when you're angry.
I think I would just wanted to ask me if I'm okay, which is definitely what my mom has been doing. She does ask me that I'm okay. I'm okay.
And how do you manage to reduce that anger?
Uh, this this is a this one is sometimes different, but for me, I do try to do something else to not focus too much on what's making me angry, or at least I just have to wait it out. I have to wait it out until I get I have to just wait. I just to wait it out until I can feel like okay, it's gone. All the anger, then feeling all the stress is gone.
So you take a break and just wait out until the anger is gone. Yeah. Mazin, do you have any other advice for parents out there whose kids maybe might be angry and might be a bit too aggressive on how to deal with that?
If I would say if they are high functioning like Mikhail, you really need to put yourself in their position. I mean, sometimes I can't do it also. We just need a lot of talk therapy. A lot. I think Mikhail, whenever he's angry, sometimes I know he calls me for no reason. I know there's something going on. So he'll just call and I said, Mommy, no, I'm just asking you're okay. So I know he's not okay.
Mm-hmm.
Yeah, it's things like that you need to be able to catch.
And I think it's very important, to have a bond with the child, a very close bond, right? Like you have with Mikhail, because a lot of parents, they have such a aggressive, distance bond with the children that the children don't go to them. The children don't feel safe going to their parents. And if the child is autistic and the child don't feel safe going to you, the child will keep everything bottled inside them. That's not really good.
Sure.
Be persistent but resilient. I think you would agree with me on this one. Don't get hurt by your child not responding to you, right?
Yeah.
Always stay positive. Do you find it difficult to always stay positive?
Yes.
Tough, right? It's not so
Yes,
easy.
it's tough. It's tough. But
Then
it works. It works.
It works. Yeah.
Yes.
Ignore irritating attention-getting behavior. Like,
Yeah.
even when you want to get attention,
I think that was when Mika was younger, but
yes.
now that he's much older, I think his
He's an
irritating.
adult now.
Yeah, his irritating attention getting would just annoy the sister and the brother.
This
So
time
just
is all
ignore them and let them be.
this time is all purposeful. This time I do it on purpose.
Sometimes
now
he does it on purpose. Yeah.
No, I know you don't fully. I know I know you love them. Physical activities, and I know you do this so well, Mazuin. I mean, you interact with them through physical activities so well. You get them horse riding, you get them, to do all kinds of activities. And Mikhail, you have to continue your physical activities, because
Yes.
you do sports now.
Mikhail?
Can you hear me? Did I just drop off? Mikhail?
You saw it's just that your mic is not good.
Oh yeah, my mic isn't that great. Sorry. Yeah. Do you do a lot of physical activities now?
Me. Sorry. I thought you were asking my mom. Sorry. Okay. Uh, physical activities. Not really that much. Ever since the MCO hit, ever since like the MCO, ever since the MCO like got worse, um, my workplace used to have like these physical activities where I myself could like teach kids how to do these exercises that we do at my workplace. But
Okay.
like now, it's something we more or less had to stop. And the only exercise that I kind of get is just this, is just what can, just this exercise that my workplace does in the morning, just to get the interns and I worked up. Yeah.
Okay, that's keep some exercise in. And then I know this is hard, but be affectionate and respectful towards the children. Show your love, show your interest. A lot of parents, they are always on their phone, and then, they don't show interest in the children. And if you don't show interest in your child's autism, then, you're going to miss the window of opportunity to make them very, very high confidence or to discover their gifts. This is something I also, really respect and admire in the way that you do it, Mazrin. Learn from your child. They can teach us so much, right? Like, for example, Mikhail taught me everything about Transformers. So when I was expert in Transformers, because he can learn everything. He taught me everything about Transformers. So good. And then you have to believe in it. Do you think it's difficult to believe, Mazrin?
Say again? Believe in Mikhail?
To believe in them, to believe in their possibilities.
Yes, I believe Mikhail he will be someone. He'll be able at least to take care of himself, or myself, or the siblings.
Well, he's already an advocate for, for autism. Being an advocate, Mikhail, you're going to be helping so many other autistic kids, who don't believe in themselves, who don't have your confidence, who is not independent. I think you're going to just by talking about it, you're going to be helping so many people, and that is, really something that I am so proud of, when it comes to you. And of course, Nazri, take care of yourself. What kind of self care do you do, Nazri? Because you're dealing with dealing with the care. What kind of self care do you do?
Right now, I just currently I just get heavily involved in home workouts. So I feel that that's more of my me time, and I will have this certain groups that group of ladies that we just go towards a healthier lifestyle. So which is actually exciting.
I know that you're doing a lot of gym and all that too, right?
Say again?
You're doing a lot of physical activities as well, right?
A lot.
Amazing. Yeah. I have to join your group one day.
Yes, you should.
Oh yeah, I know. I have to be more motivated like Mikhail.
Yeah.
So after this, you can teach me all about video editing, Mikhail. I know a lot about Transformers already now, so no need about that. So I love this quote by Stuart Duncan. Autism is not a disability; it's just a different ability. I love this quote. I find this quote to be so encouraging. All right, so for everybody out there, if you suspect that your child may be autistic, get the child diagnosed immediately. Because it makes a difference to get your child diagnosed immediately, so that you can mitigate your expectations, so that you can get help for the child. And don't be shy, like what Mazrin says about getting an OKU card. It's really fun to have an OKU card. And do reach out. You can reach out to us at 360 Wellness Hub by texting 018-471-0020. And if you have your phone with you, this is a free autism check test that you can do to just find out a little bit more about whether your child may be on the spectrum. So on that note, thank you so much, Mazrin and Mikhail, for being here and for sharing your experience with us. Really appreciate it, and I'm sure it's going to help so many people and give comfort to so many people that are out there. Thank you very much.
Thank you, Dr. Sue, for having us.
Thank you.
Thanks.
Yeah.
Thank you.
I'm going to stop sharing them here. And then after that, I'm going to stop the recording.